And in Ireland, the nation is struggling with a massive heroin epidemic, a problem critics say the government is doing little to fight. Now, the European Monitoring Centre for Drugs and Drug Addiction reported last year that Ireland has the highest number of heroin users in Europe, as you can see on the right side of this graph, and also the third highest death rate from drug use. With drugs now spreading from Dublin into smaller towns and cities, doctors and addiction specialists worry of an impending national crisis. Vice magazine has been covering this story, and joining us now to discuss it is Inez Novacic, New York correspondent for the Irish Times and producer for HBO's Vice. Forgive me if I got the name a bit funky there, Inez, but
No, it was surprisingly good.
Oh, fantastic. More importantly, how did Ireland actually come to develop this problem in the first place?
Well, I think heroin started coming into Ireland in the 80s, and as most people probably know, Ireland used to be a very poor country until the Celtic Tiger. So I think that heroin traditionally was a drug for the poor. And it first took over in Dublin in inner city circles where most of the residents were on welfare. They didn't have the same opportunity infrastructure as other wealthier residents of Dublin. And from there, it kind of just spiraled.
And, when we talk about it spiraling and how it's being contained, what is the government actually doing to help? Are they really doing so very little?
I think, yes, they are objectively. If, you can criticize and say there are so many addicts, why aren't there more specialist clinics in place? Why don't you try and legalize heroin prescription? I think, yes, that is a valid criticism. But at the same time, Ireland is a society that is changing so much and very rapidly and has been for the past 20 years since the Celtic Tiger, and now faced with a recession. I think that Ireland is doing what it can. I grew up in Ireland and I went to school in Dublin, and I remember when we were sort of around 15, 16 years old, we would regularly get addicts coming to talk to classes to educate children. So I remember very vividly there was a woman, a middle-aged woman who came from a middle-class family who was a methadone addict, had been a heroin addict for years, and talked to us. I know that at parent-teacher meetings, they also get policemen to come in and show them what drugs look like and educate about what kids would be like on drugs, and to try and root out the problem from an early age. And I know that there are, maybe not so many, but there are needle exchanges, there are methadone clinics. So while maybe it's not as good as it should be in terms of the services provided, I think that the country is trying to do what it can as it's changing and kind of grasping its new identity.
Of course, and not to overinflate kind of the claims, but I do want to just share what some people are saying on Twitter. In response to Vice tweeting out the article, Rob Reed saying embarrassing global coverage of Ireland's smack issue and inept government policy, so some criticism there. We also have Michael Farrell saying the article on heroin problems in Ireland a bit overstated, but need for action to fill service gaps. So, obviously different opinions here. In your opinion, as someone who grew up there and who's familiar with the epidemic, if you will, what are some of the social consequences that you've either witnessed or that were talked about in those school meetings, or that you're witnessing yourself if the drug use isn't curbed?
Well, I think that it is quite shocking. I've lived in New York for a few years now, but when I do go back, I do see still addicts in the middle of the day in Dublin city centre. And maybe because I'm not used to seeing it every day as I would have been exposed to, it is a bit shocking. It'll be, Saturday afternoon, 2 p.m., the sun is out and you're waiting at a bus stop in the middle of Dublin, the Liffey. It's a gorgeous area. And you will turn around and you will see somebody who has clearly just injected heroin into a system. And it's very sad to see. And it's quite shocking. And you do see them. You can see, 4 or 5 addicts just in that main street, O'Connell Street, on any given day. So visually, yes, it is shocking. And it's a very real presence. But I think that claims about it spreading to rural Ireland, while I'm sure it is spreading, I don't think that there's data yet to prove that it's an epidemic nationwide. And I think that in Dublin, there are centres and there are volunteer groups that are working with the National Health Insurance Services to make sure that there are support structures for this. So I think that the government does need to take legislative action and provide a framework for combating this, but I wouldn't really say that it's something that's the main embarrassment for the government.
Well, it's always helpful to have a nuanced perspective on this. Inez, thanks so much for joining us.
No problem. Thank you for having me.